Hi, I'm Dr. Bella, foot specialist from Restore Podiatry and Laser Centers from Hicksville, New York, and Long Island, Nassau County. Today I want to talk about plantar fasciitis in detail. This video is for you if you have heel pain first step in the morning. You want to find out why you still have plantar fasciitis. You want to know how to treat plantar fasciitis for good, or you think you will have plantar fasciitis your whole life. Agenda, I will explain in detail about plantar fasciitis, why you are suffering with plantar fasciitis, the most common causes, tips you can do at home, what are the different treatment options, and many more. Heel pain fact. Heel pain is one of the most common complaints that patients come into my office with. More than 50% of heel pain is plantar fasciitis. In fact, plantar fasciitis is the number one cause of heel pain. In this presentation, I will focus only on the plantar fasciitis. First, we need to understand what is plantar fasciitis and how do you know if you have it. The plantar fasciitis common sign. One of the common classic of plantar fasciitis is the pain on the bottom of your heel with the first step when you get up from the bed, and the pain come again after sitting down for a while or sitting at the desk. Then you get up and the heel pain come again. But as you walk more and more, the pain gets slightly better throughout the day. For severe plantar fasciitis, the pain may be constant throughout the whole day. Plantar fasciitis symptoms. What plantar fasciitis feel may be unique and different for each patient. Some may feel like a bruise or aching, sharp pain like a knife pointing, or dull pain, or stabby pain, or mixed feeling. What is the definition of the plantar fasciitis? So the definition of the plantar fasciitis, if you Google it, most of it said an inflammation of the plantar fascia. If there is an inflammation in the plantar fascia, then it will be called plantar fasciitis. However, if there is no inflammation in plantar fascia, but there is either structural changes like sprain or pain, then it would be called plantar fasciopathy. This is basically the picture of the side view of what plantar fascia really look like. It is strong and white fiber band which is about 4 mm in thickness that connects from your heel bone all the way to the ball of your foot and attaches to just behind your toes. This is the bottom of the foot view of what plantar fascia look like. It's very narrow from the heel and become wider and split into the 5 bands and attach it to each toe space. So, what is plantar fascia really made of? This is really important to know because understanding this will explain why some of the treatment options, which I will cover later, doesn't help plantar fasciitis long term for a certain patient. Just remember this. Plantar fascia is really made of type 1 collagen, which allow fascia to have elasticity and tensile strength. So what this means is that plantar fascia works like a rubber band which has the ability to stretch and return to create tension to maintain the arch. So you now know what plantar fascia look like and what it's made of. So this is basically when you work out your arms, lifting dumbbell or something, your arms get sore, or when you go for 2 to 3 miles run, your legs get sores. Why? Why do we get sore after working out or running? Because you load your muscle beyond the normal limit, or too much lactic acid built up, or this is a signal muscle to let your brain know that it is running out of the energy. So you have to stop and give your body time to recover afterward. The same concept for plantar fasciitis. This is a similar concept for plantar fascia. When the plantar fascia is overloaded or overused or stretched too much, that is not returning back to original state in proper time, it causes stress, strain, and inflammation in that area. What causes plantar fasciitis and why do you get plantar fasciitis? There are many ways that can cause plantar fasciitis. Increase weight. One of the important roles of the plantar fascia is to provide shock absorption and distribute the weight evenly. Let's say you normally weigh 150 pounds. All of the weight comes down to your heel bone. Your plantar fascia's job is to absorb this 150 pounds and distribute the weight evenly throughout the plantar fascia. All of a sudden, in 3 months, you gain weight to 170 pounds. You just give extra 20 pounds to plantar fascia to handle. Plantar fascia is currently designed for 150 pounds. It was not prepared to handle 170 pounds yet. Another way to get plantar fasciitis is overuse. Obviously, this is one of the most common causes of the plantar fasciitis. Plantar fasciitis is basically overuse. The average step is about 4,000 to 5,000 steps, which is equivalent to 1.5 to 2 miles a day. This carries so many miles in plantar fascia. Too much standing or too much walking can put many miles into the plantar fascia juices, or even more in people who are athletes, dancers, runners have even more miles in plantar fascia. Another way to get plantar fasciitis is prolonged standing. People who work long hours standing on their feet that stretch the plantar fascia and strain it. Teachers, factory workers, nurses who spend most of their time standing. So this is another way to get plantar fasciitis. So another cause is to understand how your foot works. Here I have the picture to show you. Heel bone, also known as calcaneus, can do two motion. When the heel turn inward, this is called pronation. When the heel turn outward, this is called supination. I will explain the concept of metatarsal joint locking mechanism in a simple language. Looking at this picture, the space between the two bones, yellow and blue. Yellow is the talus bone and blue is the navicular bone. And the two bones between green bone is cuboid bone and the purple bone is calcaneal bone. The space in between those two bones is called metatarsal joint. So during your foot takeoff, your foot needs to have a stable structure so that everything needs to be locked. So the heel must supinate so it can lock the subtalar joint, then this lock metatarsal joint and lock the rest of the joint so that nothing can move and the plantar fascia is taut to hold everything in place. During the heel strike, as you land your heel, the foot needs to be flexible in order to adjust to the surface. So the metatarsal joint needs to be unlocked by pronating the heel, and the rest of the joint become unlocked and provide this flexibility to the plantar fascia to absorb the weight and distribute the weight evenly. The foot must turn inward or pronate about a few degrees to allow the plantar fascia to do its job properly. So what happens if the heel pronates more? When the heel pronates beyond too much, and the plantar fascia will stretch for a few seconds more than that, that will lead eventually to plantar fascia overuse and plantar fasciitis. So anyone with a prolonged abnormal pronation can have plantar fasciitis because of the concept I just explained. This is basically another causes for plantar fasciitis. Having flat feet is another causes due to the foot structure in the picture on your left, and the picture on the right is the picture of the normal foot, and the picture of the left, that's the picture of the flat foot, and that stretches the plantar fascia a little bit more compared to the normal foot. So in this picture, on the bottom and the top. So on the top is a normal, healthy medial arch, which is normal foot. On the bottom, as you can see, the bone, it kind of collapses, and this is basically flat foot. So in flat feet, the plantar fascia is stretched more than the average foot, which means it can change the weight distribution and create overload in plantar fascia, which leading to plantar fasciitis. Having high arch is another cause for plantar fasciitis. Because of the structure, the plantar fascia slightly shortened, which means it reduces the ability to maintain shock absorbing and distribute plantar pressure properly while walking. This can cause a strain on plantar fascia. Another way to get plantar fasciitis is new job, new activities. Let's say you change your old job from sitting desk to a new job which requires standing on your feet all day. Your plantar fascia isn't prepared for this new load. Or you decided you want to exercise or work out to stay in shape, but you never exercised or work out before, and this causes new extra stresses and strain on plantar fascia that can lead to plantar fasciitis. Not wearing good shoe with no support can lead to increased risk of plantar fasciitis. So another causes is having tight calf muscles, which I have seen too many cases. So who get tight calf muscles? Pretty much everyone. Athletes, runners who doesn't do proper warm-up stretching, drivers, truck driver, taxi drivers. You can see in the picture on the back of the heel bone, if you look at this, where I am explaining right above the heel bone is your Achilles tendon. The Achilles tendon attached into the heel bone, and imagine if the Achilles tendon is tight, if it get contracted, if it get tight, imagine it pull the heel bone up a little bit. But if you look right underneath the heel bone, there's a plantar fascia that attached to the heel bone. So if the Achilles tendon get tight and the heel bone is being pulled by the Achilles tendon, and the plantar fascia is being pulled by the heel bone, overall, this will lead to plantar fasciitis. So how do we diagnose plantar fasciitis? The clinical history and physical examination is the key in diagnosing plantar fasciitis in the early stages. X-ray is one of the diagnostic imaging we use to help us evaluate two things. One is to see the bone alignment and the foot type overall, and the second thing is to check whether the heel spur is present or not. This is the X-ray of the I have two different picture. One picture on the left is the X-ray of the normal person who have the normal heel bone, and the picture on the right is the picture of someone who had the heel spur. You can see the little piece of bone is sticking out on the underneath the heel bone, and a little bit on the back of the heel bone. That is called heel spur. Um, I'm going to show you two different pictures. The picture on the left is the picture of someone X-ray who have a normal foot alignment. You can see the talus bone, the navicular bone, and the first metatarsal bone are all aligned properly. However, the X-ray picture on the right is a picture of someone who have a abnormal alignment, like a pronated foot or flat feet. You can see the talus bone alignment is not aligned with the first metatarsal. That can lead to plantar fasciitis. Okay, so this is the image of the foot X-ray in a normal person. On the left, there is no heel spur. However, on the right is a picture of the foot X-ray with a bone growth called heel spur. In my experience, heel spur are commonly seen in patients who have plantar fasciitis. I have some patient who came in to see me and they were seen by another doctor who told them they have heel spur and that causes pain. I said, heel spur is not what causes the pain, but rather the pain comes from plantar fasciitis. So this is the study published in March 29, 2017. The title, Plantar calcaneus spur, a review anatomy, histology, etiology, and key association. So they mentioned that right here, the plantar calcaneus spur are present in 45% to 85% of those with a plantar fasciitis. And they also mentioned right over here, one study showed that 45% of the heel analyzed were either painful, that have no heel spur. However, for those who have the heel spur, but they were not painful. How is heel spur formed? Heel spur is a bone growth that was formed by plantar fascia pulling at the insertion point in response to physical stress on the bone. This is Wolff's law, which dictates that bone remodeling as a result of mechanical loading allowing the bone to better adapt with increased loading. X-ray is not useful for evaluating the plantar fascia because the X-ray do not show soft tissue structures. So this is the another diagnostic imaging to diagnose plantar fasciitis is ultrasounds. Ultrasound is one of the most important valuable diagnostic imaging tool to evaluate the thickness of plantar fascia. The normal thickness of the plantar fascia is 4 millimeter. We use the ultrasound to see how thick the plantar fascia. If the thickness is more than 4 millimeters, which indicates plantar fasciitis, we use the ultrasound before and after treatment to see if the plantar fascia has been restored back to normal thickness or close to it, or thickness decreases to some degrees. Another great imaging MRI, we can show plantar fascia thickness. It can show if there's any scar tissue or degeneration, or it can show micro tears in the plantar fascia, or it can show plantar fascia ruptures. So on the left picture, you can see that's a normal plantar fascia, which is 4 millimeter thickness. However, on the right, as you can see how thick the plantar fascia is, that is way more than 4 millimeter thickness. This is therefore plantar fasciitis. So, what are the problems to treat plantar fasciitis? There are so many different treatment solutions to treat plantar fasciitis. There are short-term solutions and long-term solutions. So many patients are suffering with plantar fasciitis. Heel pain does not have to be unbearable. You don't need to skip a moment of happiness in life. Life is too short. If your current treatment plan is not working for you, then it is time for you to take a step back and educate yourself on all of these options, which I will explain coming up. The earlier you get your heel pain checked out, the easier treatment will be. However, the longer you fight with the pain and put off the treatment, the worse the condition will be and harder, much harder to restore back to normal conditions. So, no two patients are the same, no two plantar fasciitis are the same, no two foot types are the same. Everyone has unique presentation with different lifestyle and different activity levels. To treat plantar fasciitis, we need to know how the condition starts, identify the root cause, effectively evaluate whether the tissue had degeneration or not, scar tissue or not, and whether there is a blood flow or not. If we have all of this information from the beginning, then it will be much easier to treat it with the right treatment. Not short-term solution, but long-term solution. But that is not the case for most people. The heel pain will start with a pain level 1 or 2 out of 10. A lot of people will Google their problem online for answer or hoping for peace of mind. They will try to do treatment on their own, go to Amazon, buy that, or they read other people comment and try to do the same remedies. This makes people delay seeking the doctors. Some people end up diagnosing themselves with heel spur or misdiagnose themselves with another condition. After 1 or 2 months, the pain progresses to level 4 or 5 out of 10. They will they will finally make an appointment with foot specialist. At this point, the inflammation that has accumulated or the amount of structural changes that have caused further damage to the plantar fascia, the doctor will recommend standard protocol, but this protocol should have begun from day one, not 2 months. When you get to 3 months, the plantar fascia will enter into chronic stages when adhesion and scar tissue formation can develop over the time, and the healing process will be even slower. The plantar fascia can become plantar fasciosis, which is basically the combination of the scar and degeneration tissue. I've seen some patients who saw their primary care doctor before me for their heel pain, which have further delayed the healing treatment. My advice is that if you are trying to treat it on your own, if the pain does not get better after 2 weeks, make an appointment with a heel pain doctor or specialist. This is one of the reasons why doctors have difficulty treating those patients who failed conservative cares for 1 year and ended up with surgery. According to the study, about 2 million people have plantar fasciitis every year, and 10% of which is 200,000 of those people will require surgery every year. Mild cases will take about 4 to 6 weeks, moderate cases will take about 3 to 6 months, severe cases will take at least 12 months. That's why you will see a lot of study published and a lot of doctors will recommend a conservative treatment for 1 year before attempting surgery. Another important to understand is that if the pain inflammation happens somewhere else, like in the arm or something, it will heal better than the heel because the heel is all the way down under your heel and we're constantly using them every day with weight burden on them. So what are the treatment options available for plantar fasciitis? Activity modification. You must change your heavy activity that involve high and repetitive impact like running, jumping, and sports. You have to avoid them until the plantar fasciitis heal completely. You can do activity like swimming, biking, and yoga. You can return to heavy activity once your heel pain is pain-free for 4 weeks. Stretching and strengthening. Stretching and strengthening make plantar fascia strong to be able to adapt to new loading and stretch. There's so many different ways to do this. One of the common technique is the towel stretches. Simply put your towel under your foot and gently pull and hold towards you, feeling a little stretch in your foot. Towel grabbing. Towel grabbing is my favorite technique. Put the towel on the floor and try to use your toes to pick up the towel and let it go and do it again. Or you can put pans on the floor and try to pick up each pan one by one and put it into the small basket. Another way you can do is put the towel on the floor with one side rolled up about 2 to 3 fold. Stand on the towel with your toes on the folded towel side to activate windlass mechanism which increases taunt on plantar fascia and simply raise your heel and hold it and lower the heel back down and then repeat back and forth. Stair stretch. I recommend you to wear your shoes. Stand on the stair with your heel back out on the edge and gently lower your heel about 1 inch or you feel a stretch in the calf and hold it and bring it heel back up and back down, back up, repeat a couple times. Frozen bottle. Put frozen bottle on the floor and roll the frozen bottle with your feet back and forth. Okay, the insoles. There are so many different insoles. There's like 100 of them. There are okay insole, good insole, better insole, and the best insoles. The okay insole, which you will find over the counter, cushioning insole like Dr. Scholl insoles. Good insoles like prefabricated insoles, which provide good support like Walkio, PowerStep. There's a couple of them online, also which you can find them in the doctor's office as well. They are a little bit better supported than the Dr. Scholl insoles. Then we have the better insoles, which will be custom insoles. And then the best insoles would be 3D printed custom orthotics. You need the insoles to reduce the load on plantar fascia and manage the plantar weight distribution evenly. So The custom orthotic, the purpose of the insole is to reduce the loading on the plantar fascia by giving the plantar fascia arch support. Orthotic can be made completely custom and matched to your feet 100% and come in different designs and specifications. So you can see in the picture, I'm showing you what the orthotic look like, how it can help this patient. If you look at this patient, his heel is not straight. It kind of pronated a little bit. So this is what it looked like without orthotic. Then if you look at after the orthotics, you can see his legs and the ankle and the heel is kind of like more straighter. So and the picture on the right side, if you look at the bottom picture, this is what the foot look like when the foot is kind of the bone kind of like not aligned properly. It kind of collapsed a little bit. But if you take a look at it when we put the orthotic right underneath the foot models, the bones look like it got a little bit more aligned straighter, a little bit more better support. So this is the studies I want you to talk about, the plantar fasciitis with the custom orthotics. This is the study published in June 26, 2006, the effectiveness of foot orthosis to treat plantar fasciitis, a randomized trial. So they compare three groups. Group one, they put a patient with a custom orthotics. Group two, a patient with the prefabricated orthotic. And group three, we give them the over-the-counter insole, like a Dr. Scholl insole or something similar to it, like a fake insoles. And according to the study, they mentioned the foot orthosis provides a small short-term benefit in function and may also produce a small reduction in pain for people with a plantar fasciitis. However, they overall all of them do not have long-term benefits. Does custom orthotic work better than prefabricated insoles? So we have a randomized control study done by Bishops in 2018. We compare people who wore over-the-counter orthotics and people who wore custom orthotic, and they perform an ultrasound to evaluate the plantar fascia thickness for 12 weeks. They found that custom orthotic improved the pain and plantar fascia thickness reduced compared to prefabricated orthotics. My opinion, custom orthotic is recommended for anyone who has flat feet or high arch or pronated feet. Insole help and reduce the loaded stresses on plantar fascia. I feel prefabricated insoles will be good enough for people who have average foot type, but the custom orthotics with deep heel cup and plantar fascia support and the degree of flexibility and wedges are much more recommended in patient and true biomechanical abnormality. Night splint is another common treatment recommended. Night splint prevents the overnight shortening of the calf muscle and plantar fascia while you sleep. A lot of people do not like to wear this at nighttime because it's so uncomfortable to sleep with. Corticosteroid injection. This is very common treatment for plantar fasciitis. The purpose of this treatment, this injection, is to reduce the inflammation and pain. Do the injection work? There are a lot of published studies that have been done on steroid injection for plantar fasciitis, which I will show you in the next slides. Steroid injection cannot fix plantar fasciitis. It's like putting on a band-aid. Three reasons why steroid injection can worsen plantar fasciitis. Steroid injection help to hide the symptom of plantar pain and inflammation, but does nothing to help plantar fasciitis to heal. Number one, cortisone can diminish the amount of fat pad in your heel with repeated steroid injection, which will be bad for the future. Number two, cortisone stop the production of the collagen formation in plantar fascia. Plantar fascia is made of collagen. Remember, I mentioned to you before, as you to remember this, the plantar fascia is made of collagen, but the cortisone stop the production of collagen formation of the inside the plantar fascia. So this is kind of like contradictory. Many people think when they have a cortisone injection is reducing pain, then they're thinking it must be helping to heal. Well, that is not true. Instead, it hides the pain and reduces inflammation, but it doesn't do anything to heal it. Number three, steroid injection doesn't cure plantar fasciitis long terms. So this is the study published in 2003, Intervention for Treating Plantar Heel Pain. CROC4 studies show that the corticosteroid injection can provide short-term relief, which reduces inflammation and pain anywhere from 4 weeks to 12 weeks. However, there are ineffective and long-term relief after 3 months. The heel pain come back again. However, there are several issues with steroid injection which come with their risk. Here, a study published in 1998, complication of the plantar fascial rupture associated with corticosteroid injection. Two doctors evaluated 765 patients who has plantar fasciitis. Out of those, 44 patients had plantar fascia rupture associated with the corticosteroid injection. Another study in 2010, incident of plantar fascia rupture following corticosteroid injection. 120 patients received corticosteroid injection for plantar fasciitis, and only 4 patients ended up with plantar fascia ruptures. The problem with corticosteroid injection. The risk of the plantar fascial rupture can be much higher with multiple repeated corticosteroid injections. Another potential risk is corticosteroid injection can decrease the amount of cushioning fat pad in your heel with multiple repeated injections. So far, everything I have discussed, these 6 options, which I just covered, are considered to be standard, traditional treatments, which many doctors will recommend to you in a couple of visits and has been practiced for many years and still practiced nowadays. Majority of the doctors will attempt to do conservative care for 1 year, and if the heel pain is still there, then surgery may be recommended. There are different procedures for plantar fasciitis. Plantar fasciotomy or plantar fascia releases. Plantar fasciotomy, also known as plantar fascial releases, which can be done with open surgery, which is the oldest way, or with the newest way, endoscopic way. Which what we do, we cut about 1/3 of the plantar fascia and leave the remaining 2/3 alone. The idea of this procedure was that we wanted to stop plantar fasciitis, and this may help to relieve the pain. Unfortunately, this led to a new pain in another area in the foot, which we call a lateral column pain or lateral instability. It can happen after the plantar fascia releases. So, TOPAX, easy coblation microdebriders. It's a minimally invasive procedure that uses radiofrequency technology to use radiofrequency waves to break the scar tissue on the plantar fascia and jumpstart a healing process by increasing blood flow to the damaged tissue. This jumpstart the healing process and allow your body to repair the damaged tissue. So, the way this work, as you can see in the picture, right over here, around the heel, we draw a square box where we fill the plantar fascia band, and then we mark 25 spots in the grid-like pattern, and then we use the K-wire or the pin that look like this, and we poke all the 25 spots to make a small hole, and then we use a special wand into all of these holes, and once inserted, it releases a radio frequency energy to create many tiny holes into the plantar fascia to break up the scar tissue and restart your body healing by promoting the blood flow to that area. This is the easiest procedure compared to another procedure, and personally, this is my favorite procedure. There are numerous studies that have been done on this procedure TOPAX. A level 4 study published in Foot and Ankle International in October 2019, 36 patients with TOPAX easy procedure. 89% had successful outcome at 14 months after the procedure. There are other studies reporting at least about 80%. The complication are minimal, Right after the procedure, for some patients, you may not get instant relief. The pain may be worse for a few days or weeks. You need to wear special boots for a couple of weeks. But what's the problem with this? I have um, wanted to show you. I took a screenshot of this insurance Aetna, and this is right on their website. And basically, they clearly explain right here the plantar fasciitis treatment published recently in April 2023. And they mention right here on the right side, Aetna considered the following approaches experimental and investigational because there is a lack of published literature for toe packs. You can see right here, toe packs microdividers. This is another insurance, is Cigna, published in February 15, 2023. According to them, Cigna said right over here, each of the following interventions is considered experimental, investigational, or unproven for the treatment of plantar fasciitis. And you can mention they listed right here toe packs, coblation. This is a screenshot of the Blue Cross Blue Shield. I wanted to show you, according to Blue Cross Blue Shield, radio frequency coblation tenotomy is considered investigational as a treatment for the plantar fasciitis. And they mentioned radiofrequency coblation is not covered services. So many insurances, pretty much most of them, do not cover toe pass. So that is the problem with this. So basically, it's out of pocket. Tenex procedures. This is another minimally invasive procedure that can be used for plantar fasciitis. Tenex is basically ultrasonic energy technology that uses small probes, which we insert inside the plantar fascia damaged tissue, and under the ultrasound guidance, the microcutters on the end of the probe will break down the scar tissue and remove damaged tissue. This allows your body to initiate the healing process. The problem is the lack of evidence available to test how safe and effective this procedure is for plantar fasciitis. This procedure, if not performed properly, it can damage the healthy soft tissue of the plantar fascia and the surrounding tissue. TENJET procedure. This is another minimally invasive procedure for plantar fasciitis. This is the newest technology that just came out a few years ago that uses a needle-like probe, which you insert inside the plantar fascia and use a pressurized high-speed jet of the saline to break up the unhealthy damaged tissue. This is very similar to Tenex, except this is uses a high-speed jet of saline and no sharp blade is used here. This procedure is considered more safer than Tenex procedure. With Tenex procedure, a blade is used back and forth to break up the scar tissue. There's a possibility that it can break down the healthy tissue. So the problem with the TENJET, there is currently no published study on TENJET for plantar fasciitis. Because of this, we do not have the success rate for this procedure and whether it will be effective long-term outcome. The goal of this procedure, it makes sense, and this procedure purpose is to remove scar tissue, unhealthy tissue, bad tissue, and degenerate tissue without affecting the healthy tissues. Because this is the new technology, we don't have the evidence-based medicine on how effective it is yet, and the success rate for treating plantar fasciitis. So both Tenex and TENJET, unfortunately, are not covered by most insurances because of the inadequate study, and also there are new technology as well. And as you can see right here, I took a screenshot so I can show you right here. According to Aetna, they mentioned right here on the bottom, Tenex procedure and TENJET system is mentioned right here. Clearly, they are not covered by Aetna. Another way to treat plantar fasciitis is the shockwave therapy. So the shockwave therapy is basically a simulation of microcirculation, blood, and lymph nodes, and metabolism, basically nitric oxide, vasodilation, and reduction of oxidative stress. Mechanotransductions, we want to simulate the cell matrix. We want to increase the cell wall permeability. We want to release substance P, antibacterial, anti-inflammatory effects, simulation of growth factor, neogenesis of vessel, bone, collagen, simulation of the stem cell proliferation, transport and differentiation, and skin rejuvenation. Well, I'm going to explain. Very simple. Shockwave basically help. It's similar to minimally invasive procedure. However, it basically there is no cutting, no needle, no surgery. This is basically going to break the scar tissue down without surgery. So this is the study published in 2016, success and recurrent rate after radial shockwave therapy for plantar fasciopathy. According to them, the success rate at 1 month is 19%. However, 70% at 3 months, and then 98% success rate at 1 year. So the shockwave is pretty good alternative treatment for plantar fasciitis for those patients who do not want to have surgery. This is what it looked like, shockwave. Another treatment is class 4 laser therapy. Class 4 laser therapy is a medical treatment that uses a focused red light energy to simulate healing response called photobiomodulation. The cell absorbs the energy, triggering the biological cascade of events that lead to increase in cellular metabolism, decrease in pain and inflammation, increase fibroblasts to make a new collagen tissue, and improve microcirculation to the damaged tissue in the plantar fascia. So this is the study um, by a couple of doctors who did this study on 3 doctors. But so what they did, they wanted to do study on the patient on 3 different groups. One patient with the laser groups, the other group with the shockwave groups, and then the other one with the ultrasonic groups. So they noticed that, and they also did the MRI on those patients before they started the treatment and the MRI after they finished the treatment. They noted that the laser groups had about 70% success rate after 3 months. And they noted the plantar fascia, according to the MRI, that plantar fascia thickness is actually became thinner, decreases compared to the other 2 groups. So which is pretty amazing. This is what the laser treatment look like. So we offer Power Heal program, which basically we use a natural and regenerative medical therapy to treat plantar fasciitis with no drugs, no pills with side effects, avoid cortisone injection, avoid surgery. We want to increase the blood flow, reduce plantar fascia thickness, repair and reduce the scar tissue without any needle, without any cutting, without surgery. It's all natural. I hope this lecture I have went over with you have been very helpful for you, and hopefully this was explain everything in details. And thank you for watching the video, and have a great day.